Hello, everyone. Here at Flawless, we're continuing to prioritize mental health and providing resources for self-care and stress reduction during this age of coronavirus. So as we continue to speak to the experts in the field, I am happy to be in conversation today with Mike Thompson, who is the president and CEO of the National Alliance of Healthcare Purchaser Coalitions, a Flawless board member, and a great advocate for mental health. So good afternoon, Mike.
Good morning, Trey.
So the first question I have for you is, this significant focus on this global outbreak may be a cause for anxiety for a lot of people. So what recommendations would you offer to help people maintain a balanced mental health?
Well, I think we have to keep it in perspective, right? I mean, this is not the biggest virus that the world has seen, nor is it minor. And I think what we are advocating for employers and others is, let's get the facts, let's share the facts, and let's talk about what we need to do together to deal with the environment. I think it isn't a cause for panic, certainly, and it isn't a cause, something that needs to be disregarded either. And so I think the more balanced we are and fact-based we are in educating people about what it is, what are the risks, and what they can do about it, I think that it's easier for them to deal with that environment.
Okay, so you mentioned educating people. So which sources do you and the National Alliance recommend for people to stay abreast on updates regarding coronavirus?
Well, you're getting sources from a lot of places, and all of them in one form or another are derivative of the CDC, the Center for Disease Control. And we know, even when we look at the education for employers, we think what they put together is very, very credible. Oftentimes, when you're hearing from other sources, it's getting filtered or biased, and you've got to discount that a little bit. So, if you can go to the source, it's very helpful, very usable, and your public health officials, I think, have your best interest at heart, and be guided by them. In spite of this being a global issue, it also has a very local element to it as well, where different areas are in different state of emergency as it relates to the virus, and with that in mind, that your local public health officials are very important in the context on what you should do and how you should deal with it.
Awesome. And you mentioned your employers, and I actually attended the virtual webinar that kind of went in a little bit about that. But so, you, the National Alliance, has done a lot of important advocacy for well-being in the workplace. Now, what things should employers really be doing right now to support their employees' health and, well-being?
As it relates to the coronavirus?
As it relates to the coronavirus.
Yeah. So, interestingly, those most at risk are those that are always most at risk, those that have other diseases, those that are more frail. And so for that reason, I think we have to be extra careful if we are dealing with chronic conditions or if our immune systems are compromised. But a lot of the activity, I mean, the percentages of the population that have actually been infected by the coronavirus, and it's even smaller percentage that have actually been impacted in any significant way in their health, is relatively very, very small. The concern is the degree of contagion, the contagiousness of this disease. And so a lot of the efforts that everyone is hearing about really relate to how to minimize the chance that a lot of people get it. And the way to minimize that certainly is personal hygiene around washing your hands and don't touch your face and things like that. But a bigger part of that, I think, is trying to minimize the amount of close activity people have with large numbers of people. And it isn't so much that, you get it, suddenly you certainly are at risk for the risk factors, but the risk factors is still probably in the 1% range for somebody who has actually contracted certainly from a fatality standpoint, it's literally only 1%. And that compares to things like Ebola, where 50% of the people with Ebola were actually dying. So but it is 10 times the rate for the flu. And that's what part of the concern is. So I think that a lot of the activity relates to how do we minimize the likelihood that when one person gets it, other people get it. And it only if they're in close contact can they actually pass it. And so if we minimize the opportunities for close contact across all populations. The other big challenge I think we're facing from a public health standpoint is that we don't actually know how many people actually have it today. What we know is who's been tested, and we know we haven't been able to test broad parts of the population. And so because of that unknown, I think we're kind of treating like everybody is a potential candidate. And then the other major uh, factor that's influencing a lot of the public health activities is the concern that it is a local phenomenon. I think here in the state of New Jersey, I think we might have 2 people who have been diagnosed with coronavirus. Well, that's a very, very small fraction. But the concern is that in areas where there has been some contact, that they'll actually travel across the country into other communities and infect other communities, and it will grow and grow. And so there's even more concern when people are traveling across geographies that we don't increase the amount of contagion that would otherwise occur. And so all of these are largely preventive measures to stop it in its tracks before it becomes a huge issue. It's a huge issue now really because of the potential of the virus, not because of its current impact on the broad population. And that's not to mitigate those who've been infected and those who have actually died from COVID-19.
Just to give you a little background about what Flawless has been doing. So we joined a community of advocates as a signatory on a letter initiated by the Kennedy Forum that was actually sent to Vice President Pence to ensure that attention is paid to mental health as well as physical health. So I guess what I want to ask you is, what are some things being done by the Department of Health, and what do you think can be done more?
Yeah, I'm glad. In fact, I saw Patrick Kennedy's comment that if we ignore the mental health elements of the coronavirus, we do that at our own risk. And I think that's really thoughtful because it makes you think a little bit about what are those risks. So, one of those risks is the issues around anxiety and depression. I mean, the more that people start bunkering down and feeling like this is the end of the world, well, that could, in fact, be an overreaction to where we're at. I mean, this is a disease. It's real. It's something we need to deal with, but it's not something to panic about. If we all do our part, we're going to come out the other end, and maybe even in a couple of months, we may be turning the corner, and life will go back to the way it was before. But also, there's issues as it relates to things like social isolation. We know that the bunker mentality of how we are reacting to this, don't go out, don't talk to people. Well, we're going to need to balance that and find other ways to connect in the meantime. And I think we may need to do that more virtually, and we may need to figure out how to be to balance those risks with the things that we need as individuals and what our our friends and loved ones need as well. And that, it's a tricky balancing act in the meantime. But I think we should never ignore the broader issues that impact people's health and well-being in this context. I think we're trying to solve a public health crisis, but we should try to do it in the context of what people need more holistically.
Mm-hmm. And I love how you touched on, social isolation and, kind of in a preventative way. But the reality is, for a lot of people, is that a lot of people are being forced into isolation and being forced into quarantine. So would you have any specific tips for those who are going to lose that all-important connectedness and social support from others that you were just talking about?
Yeah, it's going to vary, I think, in terms of what's practical and what's real. We're thinking about visiting our grandkids, and then we're debating, should we do it? It's in another state. Should we be traveling? I don't know. Well, the good news is we can be connected with them virtually as well. And so there's a way to maintain connectiveness. Not everybody is as technologically enabled as we would or they would be. And so the question is, how do you deal with that? I think we have to be thinking through those issues. And it may be that some temporary restraints are warranted, and it may not be ideal from a connectiveness basis, but I think we should be aware of it and then try to find ways that we can connect outside of that, whether it's virtually or looking for other ways that people can feel like, you know, people are thinking of them, whether it's sending them a letter or a card or whatever. I think we've got to find ways to connect even when we can't be in person. Even for our employer coalitions, I think they are looking for substitutes that connect people in more virtual ways, even if they're not able to bring them together as frequently as they might have otherwise done so. So it's a little bit of a journey. I think we're all learning in this process, but I really like the idea that we have flagged this as not just a virus, but a total person health issue.
Mike, my last question for you today is just getting a little personal here. What are some things that you are doing personally to increase your self-care that you think others could really benefit from?
Well, I try to keep perspective all the time. You know, that you know, I put a high priority on my own personal well-being, and I haven't stopped doing everything, but I have been conscious of how this is evolving and trying to do my part as part of society to do that. And frankly, I think if you look at it as what you're doing to help your fellow people, that's a good thing from that standpoint. But I am connected with others. I have to say I've cut back on the number of times I'm going to the gym, but I am going to go to the gym. But I'm a little nervous about even the connectivity at the gym. You know, it's kind of a weird balancing act how to do that. And frankly, when we do connect with others, there's a way to do it that makes it safer, right? You know, stop shaking the hands and start elbowing, right? And then keep a safe distance, not because, you know, they have cooties, but they're recommending you to, you know, 6 feet is a good distance where you will not contract anything at that pace, right? Obviously, big crowds is not. You know, that's part of why there's been such a reaction on the big crowd issues, the rallies, the games. It's hard to keep a six foot distance when you're in big crowds, but in relatively small gatherings, you don't need to do that. And so I think a lot of this is just being smart and responsible as we move forward. And again, above everything, you know, let's respect what people are trying to do on our behalf. You know, I think this lack of trust in our institutions and whatever isn't helping us when we need to come together and do the right thing for all of us.
Oh, wow. Well, with that, I just want to say thank you, Mike, for taking the time to provide these helpful tips during such a stressful time. I can imagine your plate is piling up responsibility. I just want to say to everyone watching, if you want to remain informed, make sure to follow Mike and the National Alliance on Twitter. You can check out their handles on the infographic below. And again, thank you so much, Mike, for taking the time.
Thank you, Trey. Really appreciate it.